Hi, it's Dr. Eric Balkavage, and I'm starting a new video series called the GI series. I have so many of my patients that have questions regarding GI function, reflux, bowel problems, constipation, bloating. They have questions about how the GI system works. So what I thought I'd do is I put together a series of videos to kind of give you some of the nuts and bolts of how digestion works and when digestive processes break down, some of the conditions that they can lead to and why you can start to have problems as the digestive system breaks down. So today we want to start with part one in the series, and I just want to hit on a couple topics of importance. 70% of your immune system is located in or around your GI system. So that's a pretty important thing. So what most of the current research says is that almost every chronic health condition in this country is the result of some form of chronic inflammatory process. And chronic inflammatory processes start in the gut for the most part. Most of the immune cells, things called cytokines, are located in the GI tract. So the health of the GI tract and the function of the GI tract is really important. Along with the immune cells being loaded in and around the GI tract, you've got about 100 trillion organisms that live in the GI tract. And as long as they're kept in a good balance, things can go really well. But if the types of organisms that live in the GI tract get out of balance, then we can have some pretty significant challenges and problems and health impact. So we'll talk about that a little bit more in depth. But today, I wanted to start with just an understanding of digestion, part one of digestion. The digestive process really starts when we calm down, when we relax. As we start to relax and stimulate what we call our rest and digest system, that's our parasympathetic system, we get an increase in salivation, and salivation is really important for digestion. But as soon as we start resting and calming down and we start thinking about food, or we put food in our mouth, the digestive process starts. Two big pieces to the step one of the digestive process. One is mastication. That's the chewing and the breaking down of food. Really important, because the more we chew our food, the more we break it down, the easier it is for the rest of the digestive process to work. So chewing stimulates vagal nerve activity and really stimulates the whole digestive cascade. So chewing, really important. The other thing that's really important is saliva. And when you eat, you produce this saliva, and the saliva's got a number of properties that are really important. I thought I'd take just a couple minutes and explain what's in saliva and why making sufficient saliva is so important. You've got some water, and obviously the water in the food kind of moisturizes the mouth. It makes the helps the food just kind of moisturize it and help it break down a bit. You've got something in there called mucin. Mucin produces lubrication to both the mouth and the teeth, and also for the esophagus as the food moves down through it. We've got something in there called potassium bicarbonate, and the potassium bicarbonate kind of helps neutralize the acidity of the food and the acidity of some potential bacterial toxins, and this protects the enamel of the teeth. There's a number of enzymes that are in the saliva. One of those is lingual lipase. And lingual lipase is an enzyme that helps break down fats. And this is really important because the fats that are broken down by lipase can be more easily absorbed into the system and don't really require the need of bile acids. We have salivary amylase, and salivary amylase is an enzyme that actually helps break down carbohydrates and starches. And then we have something called lysozyme. And lysozyme has really got antimicrobial properties. Helps kill the organisms, bacteria, parasites, fungus that's on our food. And yes, almost everything you eat has some level of organism on it. And so having high levels or sufficient levels of lipase is really important. There's also something in there called haptocrine. And haptocrine, also called transcobalamin 1, is important for binding the B12 that's in the food. When the haptocrine binds to the B12, then it protects it from the acids in the stomach, so the B12 doesn't get broken down. For those of you who are into genetics, on your genetic report, you want to be looking to see if you have a potential SNP of something called TCN1, and that can make you more susceptible to B12 deficiencies, pernicious anemia, elevated homocysteine, but definitely consider that you might have some B12 deficiencies if you have some problems with that gene and that enzyme. And lastly, there's secretory IGA. And secretory IGA is the immune system of the mucous membranes, essentially. And so when you have secretory IGA, what it does is it really binds to antigens, it binds to bacteria, and marks these things for disposal by the white blood cells. The white blood cells can come and grab a hold of it, phagotize it, and destroy it and get it out of the system. So these are the main components of saliva, and now you have a general concept of what they do. So what can you do to stimulate a better part 1 of digestion that doesn't require supplements or medication? One of the best things you can do is slow down right before you eat. When we are in a rest and digest mode, we're calm, we're peaceful, we're going to make more saliva. We're going to stimulate the vagal nerve more, and the vagus nerve is really important, as we're going to learn in the next lesson, on how the GI tract functions, especially all aspects of digestion. So slow down. Things you can do before a meal. Pray. Maybe that's why the tendency for some people is to pray before a meal. It actually helps them calm down, relax, improve their salivation, and it improves that sympathetic nervous system and vagal stimulation. You could meditate. You could just chill, just relax. Don't eat on the run. Don't eat while you're in a hurry. When you're in a hurry and you've got lots of stuff going on and you're not relaxed, you're not releasing as much saliva, you're not stimulating the vagal nerve to really help with digestion, and you're making yourself more susceptible to GI problems. Don't drink a lot of fluids with food. A lot of times if you're thirsty with food and you're drinking a lot of fluid, you kind of dilute this whole process and you force foods down probably quicker than they should. A key thing to think about is if you're thirsty when you're eating, you're probably not chewing enough. You're not relaxed enough. So chill out a little bit more, take a little bit more time to chew your food, and you'll probably find you're not as thirsty during a meal. And the last is chew more. There's lots of discussion about how much you should chew. Just slow down. Take 4 or 5 more bites than you're currently doing. If you can put your fork down in between bites, chew about 20 times before you swallow, that's probably a good number. But if you take 2 or 3 bites and you swallow food and then throw it down with a gulp of water like Coney Island hot dog eating contest, the best thing to do, slow down. Drink less fluids, chew your food more. Put your fork down in between bites. All right? So look for upcoming episodes of the GI series on my YouTube site, my Vimeo site, and on my website, chronicconditionrecoverycenter.com. You can find me on YouTube at AskDrBalcabbage.com. Take care.